Welcome back, everyone. We're here to talk about sleep this time, a highly underappreciated topic when it comes to brain health and, in fact, total body health. Sleep is a very inexpensive way to make a major impact on brain fog. All right. Just a couple of reminders. I won't be providing any medical advice during this talk. The information that I present is for educational purposes only. And again, don't discontinue any medications without consulting your prescribing practitioner. And this is especially important when it comes to sleep, because some sleep medications that you're on, if you try to stop them abruptly, you may not sleep for a couple weeks. So some of these medications your body gets really dependent on, and you have to withdraw them very slowly. So, all right. The agenda for this evening, we'll be talking about what constitutes good sleep, causes of poor sleep, benefits of restful restorative sleep, and ways to improve your sleep. Sleep quality. So before we get started, let's just talk a little bit about what constitutes good sleep. We measure it by how long it takes you to fall asleep once you get in bed. How often do you wake during the night? Once you're awake, how many minutes do you spend awake during the night? And do you feel rested in the morning? Okay, so what we like to see is that you wake one time or less, that once you're awake, you spend less than 20 minutes total time awake, and that you actually wake up rested in the morning. So it's not just how many hours of sleep you get, but whether you even feel rested at the end of the night. This is a book by Matthew Walker, PhD. He's a sleep researcher, and he does a wonderful job in this book talking about the research, and it's really extensive research that he goes into regarding the things we know about sleep. And most of this isn't taught in medical school. It's just not something that we spend a lot of time with. In general, doctors, as much as anybody else in the population, tend to think that sleep is sometimes a waste of time, or at least overrated. And that's anything but true when you look at the research. So simply put, we age faster if we don't sleep well. All parts of our body suffer from lack of sleep. Brain function is just one of the many functions of the body that requires good quality sleep. Mental health also requires good quality sleep. The brain balances the function of the areas of the brain that are involved in the areas of the brain that are involved in emotions and the areas involved in thinking, and this occurs during sleep. The immune system is one of the first systems to malfunction with lack of sleep. Even with only one night of poor sleep, we see more rashes, more allergies, and more cancers. Bones do most of their remodeling during the night. So when it comes to osteoporosis or thin bones and fractures, they often occur in people who don't sleep well. It's a fascinating book. Dr. Walker does say he will consider it the highest form of flattery if you were to feel drowsy and fall asleep while reading this book, since you will be strengthening and thus remembering what he's trying to teach. This is just a chart of a study that was put out by the foundation, the National Sleep Foundation, and it shows the percentage of people in the U.S. population who get less than 6 hours of sleep per night or 7 or more hours of sleep per night between the years of 1942 and 2013. And if you'll look at this, what it's showing is that in 1942, over 80% of the people slept 7 or more hours per night, and about 10% slept less than 6 hours. In 2013, we don't even get 60% of the population sleeping 7 to 8 hours, or 7 or more hours anyway, and we get about 40% of the people who are getting 6 hours or less. The bottom line is that people are sleeping less. This is also put out by the National Sleep Foundation, and what this shows is the recommended amount of sleep per age. And in these various age groups, when you're 0 to 3 months old, you sleep a lot. 14 to 17 hours is not unusual. And as you get older, you require less sleep. But even teenagers, 14 to 17 years old, require 8 to 10 hours of sleep to do really well, and for their bodies to function really well. And then as we get the 18 to 64-year-old age group, they say 7 to 9 hours of sleep, and 65 and older is 7 to 8 hours of sleep usually. And these are just general guidelines. There's going to be some people who fall out of the range of normal. Maybe they sleep 6 hours and they wake feeling rested. But there's some interesting studies of people that have been deprived of sleep to see what happens to dysregulate their body. So the causes of poor sleep, this is what we're going to go into in a little bit more detail, but some of the more the common ones are on this slide here, and they're related to pain, anxiety or worry, interruptions, and low oxygen. So let's go over these in a little more detail though. Screen time. Screen time is really interesting because screen time is blue light. And blue light interferes with your brain's ability to process and make the sleeping hormone melatonin. So that people who are on their computers, phones, TV, those are all blue lights, and they're interfering with that sleeping hormone being produced by the brain. And so some people will get in bed after watching a movie or being up doing things on the computer or their phone for a while, and they could be laying in bed for quite some time before falling asleep. So this is one of those things we really focus on when it comes to sleep. Melatonin is not so much for keeping you to sleep, but melatonin is for helping you fall asleep. Lots of people have discomfort that keeps them awake. So it could be pain, it could be just aching all over, it could be specific areas of pain like shoulders or knees or some other joint. It might be itching. Maybe they're just, the bedclothes are not soft and comfortable. Maybe they're too hot, too cold. Those kinds of things will interfere with sleep. Stress. Stress is a really big one, and really most of my patients who are having trouble with sleep, we can pin it down to stress. And so stress keeps you from falling asleep easily, just like blue light, or it awakens you in the middle of the night and early morning hours because of a surge in cortisol. Cortisol is supposed to go up in the morning to help you wake up and get started with your day, but not at 2 or 3 a.m. So when it's going up at 2 or 3 a.m., it tells us that you are producing a lot of cortisol. And so dealing with sleep for you is really a matter of dealing with the stress during your day. There are certain foods and drinks and medications that interfere with sleep. Fatty processed foods alcohol interferes with sleep, and also certain prescription medications and other drugs that are stimulants. So the normal interruptions in life, like children who need comfort and care in the middle of the night, I don't know how mothers do it because they need all the patience in the world, and sleep disrupts that. Or if you simply have a snoring partner, that can disrupt your sleep at night. Those are a lot of the people that have sleep apnea. They'll be snoring loudly during the night, and this can be really hard on their partner. So trips to the bathroom in the middle of the night, especially if it's more than once, it can be very disruptive to restful, restorative sleep, because our sleep needs to occur in certain cycles that go on throughout the night, and this having to get up several times will be very disruptive to those sleep cycles. Too little oxygen. This is really a critical problem in our country, and we think that we get a lot of people that have too little oxygen because of sleep apnea. Sleep apnea means no breath. The brain needs oxygen. In fact, it loves oxygen, and it thrives on normal levels of it. And if your oxygen levels drop at night, your brain will hopefully cause you to wake up and take a deep breath. This is a protective mechanism of the body in the short run, but in the long run, it's very disruptive to your sleep and your overall health, including brain function. And either way, this is what we call sleep apnea, which again means no breath. Okay, so there are a couple of reasons for sleep apnea. One might be that you're getting less oxygen because your airway, your throat and the back of your mouth and all of those tissues back there are thickened because of weight gain, and that will interfere with the ability of oxygen to flow through your airway and down into your lungs. Now, another reason that we see sleep apnea is when somebody actually stops breathing, and certain people do that. They'll stop breathing for 20 seconds or more during the night. And during those 20 seconds, the oxygen levels in the bloodstream continue to fall progressively, and they can get very low. And it's that low oxygen that eventually, low oxygen and actually high carbon dioxide, that eventually stimulates the brain to wake you up, so that you take another breath. I had a patient the other day who went for a study for sleep apnea, and she woke up 57 times during the night, and she was completely unaware that she was sleeping so poorly. So, yeah, this can be a major problem for people. Sleep apnea has a number of different effects on the whole body, because we're talking about low oxygen. The body, including the brain, does not like low oxygen. And so regardless of why we have this increased sleep apnea problem in our country, it still causes many, many problems, including stroke, dementia, which we're talking about right now, dementia and brain fog, loss of vision. It can cause depression and anxiety. It can cause kidney disease, kidney failure, and heart disease, pulmonary hypertension, so lung disease, bone loss, osteoporosis, sexual problems like low libido and erectile dysfunction. All of these things can be caused by sleep apnea. So when somebody gets tested and the doctor decides they need something to get higher oxygen levels in them while they sleep, they prescribe a CPAP machine, which is attached to a mask, which either attaches to the nose if you're a nose breather, which many people are not, or it attaches to the face and it seals the face so that you get so that the machine has the ability to push oxygen into your airway under pressure at regular intervals during the night, ensuring that you get adequate amounts of oxygen during your sleep. So these are just a couple ways that this is done, and it can make a huge difference in how the person feels. It can help people lose weight, because when they're not sleeping well or they have sleep apnea, they tend to be overweight. But it causes them to be overweight also. So let's talk a little bit about the benefits of sleep. So, why does it matter? And because lots of things happen while we sleep. That's why it matters. We're going to go over the various things that occur during sleep so that you can understand better what's going on here. So just in terms of weight control and weight loss, first of all, when you don't sleep well, carbohydrate cravings are going to be higher and your appetite is going to be greater and you're going to be eating more. So you're going to gain weight, and you already have the problem of sleep apnea. This is just going to make it worse. We have better if you have the problem of sleep apnea, this will make it worse. We have better blood sugar control, and this, of course, is something that we need for better brain health. We talked about that in the food section of our class, where we said that blood sugar control is essential. Our body and our brain needs to be able to process sugars more effectively and efficiently. So and then we just talked about better weight control means less chance of sleep apnea because your weight is down, and your sleep may actually improve once you lose some of the weight that is associated with sleep apnea. Restorative sleep allows the thinking part of the brain, the prefrontal area, which is above the eyeballs, to better regulate the brain region that's associated with mood and emotions. So lack of sleep results in wide variations in mood, going from being punch drunk giddy 1 minute to intense irritability the next, according to Dr. Walker and some of the research. And what they did was they took a group of college students, and so fairly young, healthy students, and they did a study in which they had them in a sleep lab where they were sleeping 6 hours or less. They did not allow them to sleep more than 6 hours. So they took essentially 1 hour of sleep away from them each night. And they did this for a week. And at the end of the night, that's what they found, at the end of the study, 7 days, what they found was this group was extremely emotionally labile. So they would go from being really giddy 1 minute to intensely irritable the next. Sleep helps regulate this variation in moods like that. We need this balance in order to think clearly and to process information rationally and to respond appropriately. Sleep is essential for the normal function of the immune system. That's why they say less sleep, you age faster. It results in better control of inflammation throughout the body, including the brain. If you don't sleep well, you're going to have more rashes, more infections like colds and flus, more allergies, and more cancer in the long run because the immune system fails from lack of sleep. We need the ability to sort and clear debris and toxins from the brain and fight infections that cross into the brain through the bloodstream. Lack of sleep interferes with that ability. So sleep regulates emotions, resulting in less anxiety, And when the anxiety parts of the brain are functioning, highly functioning and active, it shuts off the thinking part of the brain. And so, you'll see people who go to do a speech and they can't think clearly, and it's because the fear center overrides the thinking centers of the brain. So, sleep helps to regulate that, and with less anxiety, you're able to have a much better memory, better concentration and focus, better decision making, and more creativity. Again, all of these processes are a result of the balance between the thinking centers of the brain and the emotional areas of the brain. So more recently, since it's been after 2000, the year 2000, that we started to realize that we have areas of the brain that they don't have lymphatic channels, and we didn't think that the brain had any kind of lymph flow over it. And what we were finding after about 2000 in some of the research is that we do very much have a lymphatic type activity going on in the brain. And what it is it's a deep cleaning process that occurs during sleep. So it's kind of a nightly housekeeping that goes on with this deep cleaning process, which is called the glymphatic process. The glymphatic process only occurs, or I should say primarily occurs, during deep sleep. It may occur at some other times, but not to the degree that it happens to occur during deep sleep. So what happens during this process is that when you are in deep sleep, the tissue of the brain, shown here on the right, shrinks down. Well, the tissue of the brain is shown on both of these slides. The brain tissue is white and the fluid around the brain is dark. And during deep sleep, the brain tissue shrinks down so that there's more space for this fluid to flow around the different areas of brain tissue and through them so that it can clean the areas of the brain of old dead cells and unhealthy substances, toxins. So again, these are just brain cells. It's kind of a graphic depiction of brain cells, but it shows that there's space between brain cells, and that during this glymphatic process, the fluid is washing through these spaces, removing toxins, old brain cells, and even amyloid plaques, which we talked about briefly, are the abnormally folded proteins that we find in the brain in people who have Alzheimer's. We find abnormally folded proteins that are not amyloid, other types of proteins in other brain disorders too. So this is a really critical process to have functioning really well in our brains. So again, the importance of that deep sleep cycle. The effects of sleep deprivation. So what we see after going through all that is that without adequate sleep, we're going to see weight gain, moodiness, depression, anxiety, higher blood pressures and higher blood sugar, poor memory, poor concentration, poor decision making. We'll see more heart disease, some brain-body inflammation, more colds, flus, even more cancers, and poor ability to clear toxins. One of the most dramatic examples of sleep deprivation and its effects occurred a few years ago in Japan. There was an apparent epidemic of young, healthy men who were dying suddenly of what appeared to be heart attacks. And they went back and did autopsies on all these men, and studied them pretty extensively. And what they found was that this sharp increase in the rate of heart attacks and unexplained deaths in these young men was later determined to be strongly correlated to their lack of sleep. They were averaging about 2 hours of sleep a night. So it can be a pretty dramatic problem. There's also a gene that is known to interfere with sleep. Usually starts interfering with sleep in the person's 40s or 50s if they carry this gene. And over the course of the next 18 months or so, they lose their ability to sleep completely. And within about 18 months, their entire body becomes dysregulated. So it just interferes with brain function, with immune function, with everything that we've talked about. And by the end of 18 months, these people pass away from lack of sleep. So it's a critical part of our health, but particularly with brain health. So I normally allow everybody to take a break here. This might be a good time to pause the video and go get a drink of water and come back when you're fresh. This just happens to be my grandson after his softball practice. He works really hard at it. Ways to get better sleep. So that's what we'll talk about here. So this is also from the National Sleep Foundation, and this is a PDF that I will make sure that we have on our resources so that you can download it if you want or just look at it online. But they have a PDF that talks about be your best slept self, which I think is a great slogan. And they break it down into 6 different areas of focus when it comes to different habits that can improve your sleep. So in the daytime habits, they talk about light, exercise, and meal times. And in the nighttime habits, they talk about avoiding certain things, winding down appropriately, and the environment that you sleep in. So we're going to be talking about all of these things and maybe a few more. So one of the things we find is that a sleep routine is really nice for regulating sleep in people. So we like people to wake up at the same time each day. And when you're trying to regulate sleep, that's the part of the day you work with first is the wake up time. When we talk about the nighttime routine, what we really want you to do is to be asleep before 11 p.m. And it's because the first part of the night is the most critical time for getting deep sleep. We cycle in 45-minute intervals throughout the night, but the first few cycles of 45 minutes each contain a larger concentration or a larger interval of deep sleep time in those 45-minute intervals. And that occurs early in the night. So that's why the highest quality sleep is going to be that early part of the night. One of the ways that we train our body to change so that we can fall asleep earlier is to make sure that we get up at a certain time. And so sometimes you have to use an alarm clock to train your body that way. Another thing we sometimes use is a light, so light exposure in the morning. So once you wake up, to use that blue light. Use your screens, use your fluorescent light if you want, although that's not the best. The best is daylight, to get outside and use the daylight to help you wake up a little bit more. But sometimes we use artificial light to help people wake up. So 20 minutes of exposure to 10,000 lux bright light, that's a simulation of daylight that you can buy, some light bulbs like that help you wake up. And then just getting to bed, if you want to go to sleep by 11, get in bed by 10 and just do something really low key, maybe some reading or listening to something, anything that will help you wind down and be able to fall asleep in that hour between 10 and 11. So this is just another depiction of that. When you're trying to alter your sleep schedule, this routine of light and dark is very critical. So bright daylight during the daytime, in the morning, when you're trying to acclimate your body to the daytime, that's essential. The low light in the evening is critical. So in the 2 hours before bed, use yellow light, that soft yellow light will be very helpful to signal the brain to make the sleeping hormone melatonin, which again helps you fall asleep. It should be part of that wind down routine that you do in the evening, which we're going to be talking more about. So exercise or movement improves sleep quality. It's best, though, if done in the morning or at least in the day before 4 p.m. if you're having trouble sleeping. And some people can do vigorous exercise in the evening and get away with it and fall asleep without a problem. But a lot of people cannot. And if they're not sleeping well, then that's one of the things that we look at, is to avoid the vigorous exercise in the 3 to 4 hours before bedtime, and see if that doesn't help improve it. Whole foods. Of course, we talked a lot about whole foods last time. All of those whole foods are going to be high in fiber, have a lot of phytonutrients in them. They're going to be whole grains and low-fat proteins, and foods that are rich in B vitamins. Those would be things like legumes and wild-caught fish, grass-fed lean poultry or meat, and grass-fed dairy, and pasture-raised eggs. So all of those things we talked about last week are going to be really helpful for sleeping well, and the things that we talked about avoiding were the fatty meats, the spicy foods. Spicy foods are okay. In fact, spicy foods and herbs are excellent, but not right in the evening, right before bedtime. And certainly not to have strong stimulants like strong coffee. Chocolate has xanthine, which is just like caffeine, especially the dark chocolate, nicotine, and there's a drug called theophylline, which is used for asthma and breathing, that can keep people awake. It's like caffeine. Nicotine is a stimulant, and the alcohol. Alcohol is interesting because it helps you feel like you're really drowsy, and you might fall asleep for the first couple hours, but usually it interferes with the sleep cycles greatly, by the way. And usually people are sleeping very lightly, if at all, in the later part of the night. So sleeping medications also interfere with normal sleep cycles, but just a word of caution again about this is that sleeping medications, you cannot stop them quickly. They have to be stopped slowly, or you're going to be awake for 2 weeks and wonder what in the world I was saying about sleeping medication. So everybody responds differently to different medications, and if it's interfering with your sleep, please talk to your doctor about it. All right, the timing of meals, we talked about this last time. We really want to have an empty stomach before sleep, so try to avoid meals in the 3 to 4 hours before you fall asleep, so that you're not falling asleep and trying to digest food at the same time. Besides it giving you a lot of tendency for reflux or foods to come up in your esophagus and airway, it's just not what your body needs to be doing during the night. limit the drinks before bedtime, mainly, and this is just water, mainly because you don't want large volumes of water so that you have to get up and urinate every couple hours during the night. So just that breaking up the nighttime routine and the nighttime sleep routine is very disruptive to sleep. So yeah, if you're thirsty, go ahead and have something, but just be kind of moderate about the amount that you drink right before bedtime. Napping, same thing. Some people really need naps, and naps are sometimes necessary for people recovering, or if you're just not sleeping well at night, then there's no reason not to go ahead and nap when you can during the daytime. I would caution you to just think about limiting your nap maybe before 2 p.m. would be best, morning would be best, and to limit it to less than 45 minutes if possible to avoid it interfering with that critical nighttime sleep that you need. So we're going to talk about a sleep routine that helps you wind down and signals your body that you're getting ready to go to sleep, to fall asleep. And this can be anything. Just think about when you were a child and you would sometimes get a snack, and then you'd brush your teeth, and then you'd have a story, and you'd have your pajamas on, and all of those things. And these are things that are kind of ingrained in us in many ways. And it really is very helpful for people to think about doing some of these things. The warm shower or bath, the teeth brushing, the cozy pajamas, and maybe reading a book, maybe a book that's not highly stimulating. I recommend reading a math textbook. I fall asleep so hard when I do that. So also learning to manage stress during the day and restricting some of the stimulants and activities to the earlier part of the day. Relaxing yoga or meditation can be a really helpful thing to do to wind down, and avoiding the stimulants like the dark chocolate and the vigorous exercise, the caffeine, and this is just supposed to be green tea here, and also the coffee. So it's also good to avoid emotional stress in the evening. So paying your bills, checking the stock market, doing your taxes. I don't recommend those at the time in the evening when you're trying to wind down. Same with stimulating movies. It's probably not good to get a really good adrenaline rush right before bedtime. Think about that when you choose your movies or books or your conversations in the 2 to 3 hours before bed. Melatonin. Again, we talked about this. This is the sleeping hormone, and it's really nice to just encourage your body to make its own sleeping hormone, its own melatonin. You need low-level yellow spectrum light that is not directly into your eyes. You can use blue light blocking glasses or light blockers on your screens. You can use indirect lighting on anything that you're working on. So, a lamp that comes from behind you over your shoulder is better than one coming directly into your face. That can be really helpful. You can be listening to something rather than having your eyes open even. So listening to a book or music that helps your body relax with a low light. And dim the screens on your computers. Change to the night mode on your phone. And if you really need to, you can take melatonin. They do make melatonin in doses that are about, sometimes 5 milligrams, 10 milligrams. I've seen 12, I think, at one time. But the amount that our body makes is less than 1 milligram. And that's enough to help us go to sleep. Melatonin is the hormone that helps you fall asleep. So for some people, when they wake up in the night, I have them go ahead and take melatonin in small doses in the middle of the night. And I have them use what's called fast dissolving melatonin, which is one you can get from Walmart. It's, I think it comes in about 10 milligrams, but you put it under your tongue, it gets absorbed directly into the bloodstream, and it works very quickly, as opposed to taking it and swallowing it. It takes more like 45 minutes to go into the stomach, be absorbed, go through the liver, and be absorbed into the bloodstream that way. So it's a very fast, quick way to help you fall back asleep in the middle of the night if you're having trouble with nighttime waking. It will not change the anxiety, though. So if stress and anxiety is what's waking you up, then that's a different solution for that. Warm shower and warm bath can help people relax before bed. It just relaxes your tense muscles, and it just gives the brain this signal that it's time to wind down and fall asleep. Herbal teas are very nice. Chamomile, passion flower, lemon balm, and hops. All of these teas you can get in a tea form, a tea bag form, or some of them you can get from the real food store and just get them in bulk and loose leaf, and use one of those teaspoon strainers and make yourself your own tea. Just don't drink a lot of it before bed. Just a small cup of it can be really helpful. Steep it and make it nice and strong. Aromatherapy. This works directly in the brain because our olfactory nerves from the nose go up directly into the emotional center of the brain, right in the middle there. And aromatherapies have a lot of really nice research behind them. Things like lavender, clove, rose, chamomile, geranium, jasmine, bergamot, and ylang ylang. All of these things are very warming and very soothing, and can be really helpful for part of your wind down routine. And then just having an ideal sleep environment. So most people are going to sleep best if the room is cool. If it's dark, that's also usually really helpful. But everybody's a little bit different. But in any case, a clean, uncluttered room, free from your work and projects, kind of a sanctuary for restful, sound sleep. Now, some of us live in areas where we maybe have a lot of traffic or sounds that are going to keep us awake, or maybe there's a partner who watches TV, while he's trying to go to sleep, or he or she rather, or maybe you've got a snoring partner. So some people find that sleep aids like earplugs and a dark mask can be really helpful for getting a really good quality sleep. Some people do really, really well with this. I have trouble with the earplugs anyway. I could never really, I just took them out in my sleep. They bothered me so much. But so I think if you get used to it, they probably are fine. So a warming blanket. Actually, this is not necessarily a warming blanket. This could be a cooling blanket. But the point of this blanket is that it's a weighted blanket. And some of us feel more comfortable if we have some weight on us to help us sleep. It kind of stimulates your brain's sense of safety, like when we were young. It can be warming or cooling depending on the temperature that you might need. And also, when we're talking about blankets and linens, just things that are soft and soothing can be very good for sleep. So if you're having trouble sleeping, think of maybe looking into some really nice linens for your bed. Pillows can be very supportive of areas of the body that are in pain, or if you're having discomfort from positioning, they can relieve a lot of pain associated with certain positions. And so don't hesitate to use extra pillows if you need them to help you get comfortable and sleep. White noise is also an option. So a white noise machine that does things like rain or the ocean, or some of them have an airplane noise, like when you're in the cabin of an airplane, or they sound like a fan, or they sound like that static on your television set, which we don't hear very much anymore. But some people, that can be a really good white background noise that helps them fall asleep. So sit back for a few minutes while I tell you a story. This is a story about a young woman driven to succeed, who learned to function on minimal sleep, convinced, as so many of us are when we are young, that sleep was a waste of time. As a teenager, she studied through long nights, at times struggling to pass exams and think clearly because of her fatigue, but still thinking that staying up late studying was going to work better than going to bed and sleeping. She graduated and she went on to work in a field that required her to be on call, again awake through the course of many nights and having to function the next day on minimal sleep. She was often irritable and impatient, finding it necessary to return frequently to people she encountered in her day to apologize for losing patience or simply being annoyed. She experienced high levels of pain, probably caused by inflammation, never recognizing that sleep might have helped this also. Sleep, the underappreciated drug. It never occurred to her that sleep could help her think more clearly, decrease inflammation in her body, and help her pain. She never thought that it might help her feel mentally well. Not until she was in her 60s did she begin to realize how essential sleep was for her health. She began to focus on doing just that, getting sound, restful sleep. It was a huge surprise to her to realize how different she felt after sleeping deeply. She had not done this since she was a child, and the feeling was nearly forgotten. Sleep is an absolute necessity for optimal brain function. Take another look at your sleep. If you can't fall asleep easily, if you wake frequently, if you can't fall back asleep after waking up in the night, if you snore, if you do not feel rested in the morning upon awakening, take a closer look at what you can do to change this and get your doctor's help if you think you have sleep apnea or low oxygen during the night. And before long, we'll have you sleeping like a baby, getting restful, restorative sleep for your best brain function. Thank you.